The first is a big question I think a lot of people may be thinking about, any serious side effects in Rhode Island? So we've been in close contact with hospitals who are actively vaccinating as we speak and monitoring. Trish can talk a little bit more about some of the safety systems we have in place. But as of this moment in time, every indication is that people being vaccinated in Rhode Island are experiencing nothing more than the same mild to moderate reactions that we talked about previously are expected, and include soreness at the injection site, maybe a bit of a headache or fatigue. So I just want to reassure people that here in Rhode Island, we haven't seen anything that's unexpected. And finally, I just want to chat just real briefly about misinformation. There's been a ton of information out there about the vaccine, the COVID vaccine, and we're becoming more and more aware of it here on the state level, here at the Department of Health. And we really want to ask your help to remind your readers, your viewers, to be very careful about where they get their health information. And this includes obviously the vaccine, but also other things in general. I mean, I've seen ads promoting information that is really not medically or scientifically accurate. I want to highlight some of these in a moment just to get word out. But we need to remind everyone to really seek medical information from legitimate sources, like their physician, like a healthcare provider, or other sort of nationally recognized organizations like the CDC that are really focused on science and evidence. And I know sometimes it can be difficult to distinguish between legitimate and misleading sources. I think we want to be respectful of people and where they get their information. But at the end of the day, we really want people to have the best decisions so that they can make informed choices. And I just want to remind people too, right, that all physicians, including myself, have taken an oath to keep people healthy. It's literally our job. And so as I've looked at these sources of misinformation, it's usually spread by people who are trying to make money or intentionally trying to inflict harm for one reason or the other. So just asking you all, as you have done, and thank you again, to help us here at the Department of Health reinforce the message that healthcare providers, local healthcare providers, primary care docs are a reliable source of information. So here's some myths I've heard, and I just want to throw this out there. Some of you may be aware about this, but one of the prevailing ones is that the vaccine contains a microchip, and that microchip is meant for surveillance by the government, et cetera. So I just want to dispel that myth that this vaccine does not contain a microchip. There's no technology that exists to put microchips in vaccines in the first place, et cetera. So that's something that's circulating that I just want to address. A couple other ones that we've heard of that I just want to also quickly throw out there. There's a piece of misinformation about the vaccine altering one's DNA. So these vaccines are messenger RNA. So the RNA never actually enters the space in the cell that contains the DNA, the nucleus. The RNA stays in the cytoplasm. So there's no biological reason in thinking about the science or evidence of that this RNA will alter or even affect or even come in contact with your DNA. So that's one thing that I just want to clear up there. Another piece of information here is the vaccine will give you COVID-19. I want to reassure again and make the point that this vaccine is a piece of mRNA, a piece of the viral RNA, but it codes for a very small piece of the actual virus called the spike protein. There's no biological way that this vaccine could lead to a live infection with COVID-19. It's impossible. A couple other ones that our immune systems, one other prevailing myth is that our immune systems are better than vaccines. So it is true that natural infection sometimes does lead to better immunity than a vaccine. However, I think what we've seen is that a lot of people have asymptomatic infection. It's not clear, and I would suspect that if people have had asymptomatic infection, that they have not developed a very robust immune response because they're asymptomatic. So that's why people who've even had COVID-19 before need to be vaccinated. And so I just want to address that as well. The final thing I just want to get out there is that the flu vaccine protects you from COVID-19. There's no evidence to support this claim. The flu is very specific to the flu and not COVID-19. Each vaccine is unique for that infection. Again, the Pfizer and the Moderna vaccine contain little pieces of the virus, which code for the virus. It's not against anything else. So it's very specific against COVID-19. And then finally here, one other one just to address my last point here is that there's been some misinformation around how the vaccine may cause a positive test result on viral tests, and that's also untrue. So the viral tests that are being done look for different parts of the virus than the ones that the vaccine codes for. So you will not, if you get the vaccine and you do happen to take a PCR test, you may test positive, but that would be indicative actually of an active viral infection.